Welcome, everyone. Welcome to Notre Dame International's virtual roundtable series. Today's roundtable is focused on the issue of domestic violence, and we'll feature perspectives from India, from Mexico, and the United States. I'm Father Bob Dowd, Assistant Provost for Internationalization here at the University of Notre Dame. And we're really glad that you've joined us for this very important conversation. Before turning it over to our moderator, Laura Miller-Graff, I just want to let everyone know that we'll probably go about 45 minutes with the discussion, and then we'll open it up for questions. Some of those questions have already been submitted, but we welcome you to submit questions using the Q&A feature at the bottom of your screen. We may not get around to all of the questions, but we certainly will do our best to get to as many questions as we possibly can. So with that, I'm going to turn it over to my colleague and friend, Laura Miller-Graff, who is Associate Professor of Psychology and Peace Studies here at the University of Notre Dame. Laura.
Good morning, everyone, and thank you so much for joining us today. Globally, domestic violence, which refers to diverse forms of violence affecting individuals in their closest interpersonal relationships, including both intimate romantic relationships and familial relationships, is one of the most pervasive and preventable threats to human flourishing. Though not equally, it affects individuals of all races, classes, nationalities, and identities, and can occur at different points across the lifespan. It's been consistently associated with a range of negative short and long-term effects on physical health and psychological health. Yet, despite the evidence of the pervasiveness and ill effects of domestic violence on human flourishing across contexts, it's also important to note that its antecedents, expressions, and implications are intertwined with social and cultural norms, are impacted by variations in government policy across nations, and may differentially intersect with other forms of structural violence and adversity across settings. In the past year, no adversity has been so salient as that of the COVID-19 pandemic, which, outside of the devastating losses it has exerted on human life, has also raised global concern about the prevalence of domestic violence. It has also highlighted our collective awareness of the importance of bringing together the wealth of accumulated knowledge on domestic violence around the world and working together to exchange learnings and work together to promote effective change. For this reason, I'm delighted and honored to welcome today's panelists, each of whom brings unique expertise in domestic violence, and together they will illuminate ways in which the pandemic has affected their communities, but will also highlight ways in which we can work towards practice and policy aimed at better prevention and intervention for violence. Joining us this morning is Dr. Amy Bonomi, who is a professor and director of Michigan State's University Women's Leadership Institute. Her scholarship and practice focuses on equity, anti-violence, and anti-oppression. Her work on domestic violence recantation is nationally renowned, with her publications regularly used and cited in the US courts. She also regularly trains organizations on unconscious bias and leading through an equity lens. Dr. Nireen Daruwala directs the Society for Nutrition, Education, and Health Action, a nonprofit organization working on public health issues in Mumbai, India, and directs programs on the prevention of gender-based violence with communities in urban informal settlements. Her practice and research have contributed both to the discourse and intervention on gender-based violence in South Asia, and her work includes focuses on mental health, community intervention, and institutional responses. Dr. Cecilia Martinez Tortella is a research professor at the Universidad de Monterrey in Mexico. Her research addresses the mental health impacts of interpersonal violence on women and their children, as well as neuroendocrine, family, and environmental factors that amplify risk or promote resilience. She's an investigator on a national study of the psychological effects of COVID-19 in Mexico, and also collaborates with the Women's State Institute, researchers at Notre Dame, and the University of Memphis to adapt and evaluate an intervention for pregnant women exposed to violence. We'll start our conversation with some prepared questions, which each of the panelists will respond to. And then, as Father Bob said, we encourage you to submit questions in the Q&A throughout, and we will tackle as many of them as we can. So just to get started, I would love for each panelist just to kind of orient us and provide us a little bit of information about how the pandemic has affected families in your community.
Good morning, everyone. Thank you, Laura, and thank you, Robert and team for inviting us. So I'll start a bit here with some sobering data from the United States. So for COVID, more generally, we know for almost a month now that new cases of COVID have been trending upward. So as of this morning, we're around approaching 8 million cases in the United States. 17 of our states have hit new highs in 7-day averages of case counts. We know also, I think, certainly here in the United States and globally, that shelter-in-place mandates throughout have been associated with increases in domestic violence. So obviously, with families spending more time at home together, professionally, schools, et cetera, being closed, job losses and economic strain, and then social isolation, all of those factors contributing to what we're seeing in terms of increases in domestic violence. And I want to talk about a new study that's come from Gozanji and colleagues, published in Radiology in August of 2020, where they had used x-rays collected at Brigham and Women's Hospital in Boston to show that, in fact, we've had a doubling of abuse cases, at least in that setting, in 2020 as compared to 2018 and 2019 combined. They also, in the study, showed that the number of deep injuries related to domestic violence was more than double compared to the period in 2017 through 2019. So really sobering data there. We also know that domestic violence related police calls have increased. So a study coming out of Chicago by Bullinger and colleagues in August of 2020 reported that COVID stay-at-home orders increased DV-related calls for police services, especially in areas with high proportions of renters. So that relates to socioeconomic status, of course. However, arrests for domestic violence fell during that period. So calls have increased since COVID broke, but arrests have gone down, at least in the Chicago area. A couple of other things I'll state and then stop and turn it over to the other panelists. So while domestic violence police-related calls increased, some domestic violence hotlines have experienced the opposite. So Evans and colleagues in a New England Journal of Medicine editorial talked about how some hotlines have seen drops in calls by about 50%. And we know this is because victims were unable to safely connect with services. So they're more likely to be at home with the abuser, unable to kind of escape to a place where they can access and make calls and reach out for services. And then finally, we know that some US courts have closed as a result of the pandemic, making it really more challenging to both resolve open domestic violence cases, to file necessary legal processes. However, some cities like Seattle have attempted to address these issues and have done so well with e-filing, for example, for protection orders. So some sobering statistics around where COVID is heading and domestic violence related events, but some positive things such as the e-filing out of Seattle showing that there's some actual ways to work around this. I'll stop there.
Thanks so much, Amy. Cecilia, I'm wondering if you could maybe provide us a little context.
Sure. Good morning, everyone. And I am really honored to be here and being part of this conversation. So many of you may be familiar with what is going on in Mexico, given the proximity with the United States. We share a border. And so, as you may already know, we've had a high impact of COVID-19. By this Wednesday, there were about 130,000 cases confirmed. And even though the number of cases might be relatively smaller to some other places, our death or mortality rate is relatively high. So there were 85,000 deaths reported by yesterday. And another concerning element is that daily cases remain high. So there were 4,000 new cases in the country. In terms of how the pandemic has affected families' lives, for context, we had our first case in Mexico City back at the end of February, with the first death documented mid-March. And around this time, pretty quick and strict measures were taken. Around mid-March, the National Ministry of Education closed all public schools. Private schools were also closed throughout the country. This sort of coincided with our spring break, which was sort of then a temporary closing, but after spring break, distance instruction was implemented at different levels throughout public and private schools. Even at the university level, all universities went to remote or distance learning. There was a 2-month lockdown or national emergency where all non-essential industry was suspended. And so this was happening during May and June. And this included many government offices. So there was a huge decrease in mobility. There were some statistics about the use of public transportation and just mobility, and there was a huge reduction. But after these 2 months of lockdown, a gradual reopening began in June. And states were left sort of to decide how they were going to implement this reopening. And states did many different things. For example, here in Monterrey, the city I reside in, there was a quick reopening of most industries at reduced capacity. So indoor restaurant dining has been available since June. Shopping malls opened since August. Many individuals continue to work from home, and all primary schools remain doing distance learning, and the same goes for universities. But there's huge increases in mobility, which can be reflected in the fact that in our state we have a very high number of cases, and we continue to have about 400 new cases to 500 new cases every day, and 20 to 30 deaths per day. I, as Laura mentioned, am part of an initiative, an effort to document what's going on with the pandemic here in Mexico. And so I'm part of the SCI-COVID study, which is an effort of more than 15 investigators here that is led by Dr. Martinez Blanquet at Universidad de San Luis Potosí. We conducted an online survey and more than 7,000 adults participated. This was distributed throughout all the different states in Mexico. We did get differential response in that our sample is highly college educated, middle class, and 70% female. But the responses give us a good insight about how the pandemic has affected families. And what we are finding is that some of the areas most affected include sleep, work, and income. We're also finding increases in depression, anxiety, and somatic symptoms. And of note, and as probably you've also seen reported in many other outlets, women are being more heavily affected by the pandemic. So 60% of women reported that their sleep was somewhat or a lot worse. 57% of women reported problems in their work during the pandemic, and 44% reported that their income had worsened. Also, about 1/4 of men, 25% about, and about 1/3 of women reported symptoms of depression or anxiety more than half of the days. And also about 20% of women reported headaches or backaches, which were the most common somatic symptoms. And this disproportionate burden on women likely relates to their increased responsibilities at home. Unfortunately, there's still a very unequal distribution of labor in many households, and also to their higher economic vulnerability. And the last thing I'm going to say is that we found a significant protective factor that we're a little surprised about for mental health difficulties. And so women who reported they were taking care of children in their home had lower symptoms of depression, anxiety, and loneliness, and also less somatic concerns. And so on the one hand, I was just talking of this increased burden, and we all know who have children that is really challenging to try to do it all. But at the same time, this is consistent with some qualitative data that we gathered from partner violence survivors focus groups last fall here in Monterey, where women talked about how their children were a significant source of resilience and strength in terms of coping with and recovering from violent relationships.
Thank you so much, Cecilia. And last, Nyreen, would you be able to provide us a little information about your context?
Thank you, Laura, and thank you, Notre Dame University, for inviting me. We work in urban slums of Mumbai, and I would like to show you a picture of urban slums. And this is Mumbai, where urban slums, where 41% of people actually live in these areas. And as you can see, they are characterized by poor quality of housing, overcrowding, sanitation is a big problem, and density. So every house is sharing a wall with another house. What happened was the COVID outbreak. Suddenly, and in India, we had very strict lockdown, and it started out early on. What happened was, I think people did not get any time to react to it. People couldn't manage it, and of course, it led to a lot of rise in domestic violence. So, in the month of March, the National High Commission for Women reported twofold increase in cases. And when it comes to our own data, we are running counseling centers in Mumbai. But in what happened was the COVID situation amplified the causal factors of violence, food insecurity, the loss of livelihood. All these women paid a heavy toll because women bore the brunt, increased household work. And as a result of it, domestic violence was reported a lot. And if we go to the next slide, Ali, then I can show the numbers. So this is a comparison where before COVID and after COVID. So what I want to bring in here is domestic violence or intimate partner violence is not new. And in the last 20 years, in a complex setting where we work, we have been having maximum cases of domestic violence and intimate partner violence. But in the last 6 months, in the time of COVID, the underlying reason for women reporting a lot of domestic violence was their coping had completely devastated. They could not manage in the home. Or overall, on top of it, there was so many other insecurities. Public health system was really trying to reach out to these urban slums. And all the numbers in the last 6 months, we saw an increase in reporting. And interestingly, the increase in reporting was through our helpline and through a crisis email facility that we have provided through our website. So before COVID, we had about 30 cases being reported on the helpline. But in the COVID period, we had almost in a month 100 cases reported on the helpline. And for us also to figure out and to provide interventions on the phone has been, initially it was challenging, but later on we could do it much better. And the star thing that we saw was women reported a lot of mental health issues. And the mental health issues were interwoven with issues of violence, issues of conflict in the family, and financial crisis. Thank you, Laura.
Thank you so much, Nyreen. I think, there are a couple of things that emerged from everyone's responses that I think are important to highlight. And one is that, you know, throughout the context of this pandemic, we have kind of the ongoing individual level mental health effects, but there are in each context lots of structural inequities that fold into and exacerbate the particular negative effects of violence. And so, you know, many of you spoke to problems with access, problems with insecurity in different domains and how they can kind of amplify, I think, as Nyreen said, the effects of violence. We received a number of questions prior to this about kind of the complex intersection of domestic violence and other pandemic-related stressors. So I'm wondering if each of you can comment on that and also give some thought to, you know, other types of intersecting factors. So ones we've received questions about would be the intersection of things like being undocumented, you know, experiencing a disability, questions about how class and color intersect with care and access to services. So I'll just open that up and just ask, you know, welcome your comments and thoughts on that. Amy, I think you're muted. Or, oh, and Nyreen.
Thank you, Laura, for the question, and thanks to the panelists. Thanks to the participants for the great questions. You know, clearly you're zeroing in and on the critical issue here when we think about domestic violence, intimate partner violence, sexual violence. So I want to say a couple things about this. So I'll talk about United States context. So we've got a current racial and political context, particularly following the murder of George Floyd. For those on the call who are international, who was an African-American Black male who was killed at the hands of police and sparked many racial protests as well as equity processes and organizations across the United States. So our current racial context has created this further attention drawn toward the importance of COVID-related disparities along racial and ethnic lines and to inequities that minoritized women experience related to domestic violence and sexual violence. Of course, many who've been working in the fields of domestic violence and sexual violence know that these impact women from minoritized racial and ethnic identities in more pronounced ways as compared to other women. It's not to take away from the impact of domestic violence and sexual violence for women overall, but just to say that these effects tend to be more pronounced. For example, we know from studies, for example, from Petrosky did a large national study, and then Medel Herrera has published something recently that women have long suffered higher domestic violence rates, hospitalizations, and abuse-related deaths compared to non-minoritized women. We expect, given COVID, that this divide will become even more pronounced as things continue to unfold related to stressors, disparities in access to care, et cetera, especially for women identifying as what we call BIPOC, so Black, Indigenous, and persons of color. The third and final piece that I'll mention related to this, Laura, is that the COVID-associated economic crisis has created obviously an incredible amount of strain for families, certainly here in the United States, I'm guessing globally as well. Similar types of economic strain we know from prior studies has been shown to increase domestic violence episodes and domestic violence related emergency department visits and hospitalizations. And this, again, is more pronounced for women who identify as African American or Black or Indigenous American Indian here in the United States. So some concerning things to think about, how COVID is intersecting with domestic violence processes for racial and ethnic minoritized women, and at the intersection of financial strain within families.
So I can say about the intersection that we have observed in COVID, and of course the biggest is poverty and financial crisis, but also we saw a lot of intersections with women from minority communities. We saw a lot of interaction intersection with women who kind of consider themselves as having alternate sexuality. And all this was reported a lot on our helpline. Interestingly, a lot was reported on natal violence. And the natal violence was when young women called us up and they said that my family has been very controlling because I'm in love with another girl and I just don't know what to do. So we immediately did a study of about 1,000 women who had already approached our counseling centers. And their accounts of violence were, the intersections mainly were financial crisis, a lot of control in the house, women having absolutely no mobility and no decision power, and increased workload responsibility to a point where they had absolutely no space to cope with their own life. So, yeah.
If I can speak a little bit about the specific situation here in Mexico, I think the COVID-19 pandemic intersected with a critical moment in the country in regards to domestic violence and women's rights. During 2019 and even before that, but there's been great increases in cases of violence against women and also cases of feminicide or hate-based murder of women. And so the statistics are that about 10 women are murdered each day due to hate crimes. And because of these, there were national big protests and mobilization during 2019 and 2020. And in fact, the week or 2 weeks before the lockdown began here in Mexico, we had for International Women's Day big protests and peaceful marches and a national day of where women did not participate in the economy to sort of demonstrate the importance of women. And so we have that intersection, that this is happening at already a really critical moment in terms of violence against women. Also, we know that women who have less education, so women who only have a primary or secondary education here in Mexico are more likely to be victims of domestic violence, and the same is true for women living in rural areas. And these groups are also less likely to access care. And so thinking about some of the comments from previous speakers, here I also want to give an example of a study by Silverio Murillo that documents how during 2020, during the pandemic, there's been a decrease in police reports of domestic violence in Mexico City. But that does not map on with increases to hotlines or increases reported by other organizations like the National Shelters Network, which shows us that really women are having more difficulties accessing care and services, given some of the barriers that others have mentioned, being at home with your abuser, if you have a lower level of education, not knowing how to navigate the legal system, and also for many women being worried that they're going to be re-victimized by making a police report. I also wanted to point out very quickly that something else that we might see in terms of intersections with other sort of identities and life stages is that we might also see different effects for women in different stages of their lives. And so another study that we have going on here at Universidad de Monterrey was a student mental health survey where we surveyed about 650 students back in May, closer to the beginning of the pandemic. And we found that 30% of students reported psychological violence, 8% reported sexual violence, and 10% reported physical violence. And for women who reported in May that they had experienced partner violence, we found increases in their drinking throughout the summer. and also higher rates of depression, anxiety, and PTSD during the fall. And so we're finding that these effects are specific for women, and we don't see the same relationships for men. But also that, interestingly, in our sample, where most of our students live at home with their parents, there's been a decrease in alcohol use during the pandemic. But that is not the case for women who are reporting partner violence prior when the pandemic started.
Thanks to all of you for your comments on that. I think one thing that stood out to me, across your comments when we're talking about, different kinds of intersecting risks, is that, you all in different ways spoke to how important it is to have kind of a multiple indicator approach to understanding and assessing both the prevalence and severity of violence and its effects, because some of the common indicators may not be particularly representative due to lack of access or stigma associated with accessing care or reporting issues. And one of our questions that we received prior to the panel was a question about what are some red flags, or what should we be looking for to better identify and as a way of starting to address this type of violence. And just wondering if you could each maybe reflect a little bit on ways in which you think multi-method approaches can be used to capture what's going on right now a little bit better, particularly for those who are minoritized or marginalized.
Yeah, no, I absolutely agree to that, and I think the way to do it is have different center points from where you can collect this data, and I think data from NGOs who are actually doing this work day in and day out would be one focal point. The other would be the health system, because women haven't stopped going to public systems for their medical reasons, and I think the health system would be one point. The police has been one. A lot of data would be received from the police, because women normally, even in the times of COVID, when we were not able to physically help them out, they had only one option. We coordinated on the phone and they went to the police. So I think these are several data points from where we can actually get an estimate of how many women have reported violence. And my sense is, and what we have seen is, most definitely, I think, like the National Commission for Women and police are two very important data points for us to gather and understand how the pandemic has affected women.
I wanted to just echo what Nareem was mentioning in regards to the importance of interagency or sort of collaboration between multiple agencies, governmental and non-governmental. Here in the state, we have a reporting system that is kind of just started in the last few years, where this information is centrally located and coming from different agencies. But even then, there are challenges in terms of the interpretation sometimes of some of this information. Like if somebody's calling 911 for support, how is that going to be sort of referred, and how it's going to be handled. And so a new initiative that was just launched this month is an app where women can download this app, and through the app they can report incidents of violence without having to be necessarily interfacing with the police or other sort of more formal agencies. and they can receive referrals. They can be given a list of different organizations, governmental and non-governmental, that they may be able to access. So I think something like this that takes advantage of technology, that protects women confidentiality, and that is relatively easy to access, it's very innovative, and it's a step in the right direction.
Oh,
I love what both Nyreen and Cecilia have shared, just such great perspective and ideas for all of us to consider in this, remarkable, unusual time that I don't think we're nearly close to being out of anytime soon. To just echo and also add a couple of different things around on what Nyreen and Cecilia shared. I think, obviously since support right now is compromised for domestic violence survivors, traditional approaches might be less effective, even less effective than usual. So in the short term, as Nyreen and Cecilia were mentioning, we really need to focus on doing proactive outreach and not waiting for survivors and victims to ask for help. So in considering that, maybe considering points of contact and resources in places where survivors may be interacting. Nyreen mentioned, for example, healthcare facilities. Women haven't stopped accessing healthcare facilities. Some other things that we've thought about in Michigan are providing proactive outreach at food distribution centers when people come to pick up meals, schools, et cetera. I think there are other types of resources that we can be providing, even if it's not direct DV related or sexual violence related, that could be helpful to survivors during this period and their families. So for example, in Michigan, we started an effort in food distribution centers in Detroit where we made homemade masks that we were putting a package of 4 in each food box that was distributed. And when people came to pick up their food, they would have masks. So that's one safety measure, obviously not specifically related to DV, but could be helpful to families who are in domestic violence situations. So things for us to think about in that proactive way. The other piece I mentioned is that, some places internationally, I'm not aware of anywhere in the United States, but some countries such as France have started open spaces for women due to shelter overflow. So when traditional spaces are full, such as housing, they're opening hotel spaces and other homes to provide women and children who might need an exit strategy, a safe one, that aren't able to access traditional housing services for domestic violence. I think, as I mentioned earlier, the use of e-filing for various legal assistance, if it's possible in the country where you're located. So I know Seattle, Washington has launched an e-filing system for protection orders, which they say in this early period has gone well. We know some of the perils of protection orders. It's merely a sheet of paper or merely a documentation point. At the same time, having a protection order, we know can be a deterrent for stopping domestic violence. And then the last thing I'll say here is that a recent paper by Chandan and colleagues in The Lancet in 2020 recommended the public health approach, which includes the 4 steps, which Nyreen and Cecilia have covered. So identifying good surveillance systems, identifying good systems to evaluate risk factors, developing and evaluating interventions, and scaling up interventions. I think with these public health approaches, what I would argue is that we've constantly got to be probing ourselves and our organizations to use an equity lens to mitigate the impact of unconscious bias or implicit bias at the intersection of age, gender, disability status, race, ethnicity. So for example, a lot of administrative databases for the healthcare system, for example, ask if you're single, married, or divorced. So the problem with this, of course, is it's a heteronormative approach that tends to leave out the experiences of gay, lesbian, trans persons who might be experiencing domestic violence. Just a relationship classification is biased, and we need to be changing the way we kind of think about the way we ask people things through this equity lens at that intersection of age, gender, disability status, et cetera. I'm sorry I went on a little long there.
I just have one comment to make, and that is, I think the whole world is very reactive and we are reacting to a pandemic, and this is not the pandemic which has happened the first time, but and all pandemics have seemed to be having an impact on women and children the most, but we never learn. So I think having a good surveillance and institutionalizing these kind of surveillance data, I think that is where we need to learn. We never learn. We always invent and reinvent a new thing. But why can't we be more prepared to and have the surveillance data in public health systems, in the police, in legal systems, which will help us to overcome this problem the next time?
I think that's right. Could I add one more thing to what Noreen shared there? I agree with that. I mean, I think too, better ways to link the data. So everything's so disparate now. The police databases are over here, the court databases are over there, hospitals over here. And I know that there are many confidentiality issues, particularly when we come to healthcare. And at the same time, right, especially from a survivor standpoint of having to navigate all of these systems, often in a highly traumatized state, right? And I think there's misperceptions among the public at large that, you know, experience domestic violence, and once you're out of the relationship, the trauma is gone. Well, the reality is the trauma continues for often for a number of years. So even though you may be not with an abuser, and then having to navigate all those systems, I think is really challenging for survivors. And so if there's, as Noreen saying, better ways for us to capture and make linkages across these things, as Cecilia mentioned, like better partnerships between government and non-government agencies. I think we're still, I'll stop there.
Yeah, I think what everybody has said has really resonated. And one thing I was struck by across everyone's comments is, you know, the ways in which the pandemic has really forced people working in domestic violence intervention to adapt in very different and creative ways the services. And as Nyreen said, right, it's really, really critical that we institutionalize those learnings, and as Amy mentioned, kind of connect the dots and across different agencies and forms of data. Because, you know, in a lot of ways, even though the physical access has been reduced, and I think we've certainly seen this in our research lab with our transition from providing in-person services to virtual services, the availability of those services, while it can't reach everyone, actually does reach some people who weren't able to access services potentially before. And so I think, you know, one of the learnings, at least for me, that I think would be interesting to think about how to systematize and institutionalize is, you know, maintaining the diversity and spread and of services that have been developed throughout the pandemic, so that we have kind of broader reach moving forward. I'm wondering, you know, thinking towards that, you know, from each of your perspectives, what do you think some of the priorities are moving forward for prevention and intervention? And you can take that either from, you know, a direct practice perspective, if that's how you'd rather approach it, or kind of more of a government or policy perspective. What are some of the things in your mind that would be most impactful?
I think sort of joining these ideas that Noreen and Amy were mentioning of preparedness and proactiveness and not being reactive. At least here in Mexico, I think a big picture approach, it's really necessary in terms of just gender equity and larger issues of power disparities between men and women. I think this needs to be addressed through education, through employment and income equality, equality in the division of home labor, and I think really importantly, representation, so that women who are low income or women who come from minority ethnic backgrounds are part of the decision-making conversations. which as of now is not necessarily yet the case. I think having those perspectives at the macro level, but also at the agency level, I think if you don't necessarily have representation, making sure you do have the voices of those people that you're going to be working with. One approach that can be used around that is focus groups or sort of participative research where these individuals will have more of a say in the decision making and what kinds of services are really needed and wanted. For example, our work with the Women's State Institute, their statistics are that the services that women are most requesting during the pandemic are social work services, so services that relate to their needs around food, housing, employment, vocational training. And so again, going back to those intersections, how DV or domestic violence is not happening in a vacuum, it's happening in the context of all of these needs that also need to be addressed. And I think also hearing these women's voices also allows us to incorporate a resilience or empowerment perspective. And so I know, Laura, you're familiar with this project, but we are in collaboration with the University of Notre Dame and the University of Memphis in the process of offering a pilot intervention for pregnant women that focuses on empowerment. And to be able to do this in this sort of new virtual and online setting, we went through this process of trying to understand what women really needed through focus groups.
I think, Laura, at the macro level, for a country like India, it is very important to have public attention on domestic violence. And what has happened traditionally in India is there is a lot of public attention when it comes to sexual violence, but domestic violence is always considered to be a very private matter. And we have spent years and years trying to build this up, that domestic violence is not a private matter, it is a public health concern. And I think in COVID time, it would be really, since the issue has got so much of attention, I think this is the time when we need to encash with public systems, with the police, with the health systems, on how we can really bring this into their radar and make it a public attention. So that is more at the macro level. At the practice level, what we really learned in all these 5-6 months is we could never comprehend doing counseling or providing crisis intervention services through a telephone helpline, because we had physical spaces where women used to come and ask for help, and we were forced to really go online and do our intervention through the phone. But I think because we moved it very swiftly, we understood that the need of the hour is, if you really want to reach out to many women, not many women even want to identify themselves, but they want the service. So I think we learned that having online platforms where women can talk, women can really ask for help and get direction is the need of the hour. And there are not many, of course, the government, besides the national commission, there's no facility for women to call or to ask for help. The NGO, the third sector, has been filling this gap, but it's not enough. So I think that is the need of the hour. And how one is the woman calling and asking for help. But what do you do with the perpetrator who is right there, sitting with her? And so that is what we learned, that when a woman calls, how do you really, in the same space, how do you help her navigate her problem with the perpetrator? And how do you really, at that point of time, kind of abate the crisis? So these are some priorities for us.
I completely agree with Nareen and Cecilia, and really appreciate their perspectives, and learning some from them as well, and think in terms of things that we can think about here in the United States. I think we had to mention that domestic violence and relationship violence is being called a shadow pandemic. And with it being a shadow pandemic, we're hearing a lot, at least on the news here, of mental health related concerns, social isolation concerns. And I guess at this time, with domestic violence being a shadow pandemic, could we elevate it to the level then it's getting the level of attention in public spaces and public media that, say, for example, mental health and social isolation is if we want to begin to kind of pivot societal attitudes, this might be an opportune time to educate. It could be, I'm not sure. Sometimes, such social experiments might fail. Sometimes they might be successful, but maybe elevating, figuring out ways to elevate. To build on what Noreen and Cecilia were saying, is there a way that we can lobby for government, right, to provide more funding to look at studies that make a better connection and intersection between all of the spaces that survivors typically interface with, so healthcare, police, social work services, housing services, et cetera. I think there's some of those studies that are funded now, but we know we look at funding, for example, for other types of health-related conditions in the United States, such as cancer, such as mental health. We know that funding for relationship violence, domestic violence, sexual violence pales in comparison. It's not to take away from the importance of mental health and cancer and other areas that require such intense funding. At the same time, when we're seeing the prevalence that we're seeing related to domestic violence and sexual violence, the fact that the funding has really paled in comparison with these other conditions is, it's unacceptable. And we need to find ways to increase funding, particularly looking at those, how do we improve intersections between all of those services, healthcare, police, et cetera. I think too, to go back to a point that I made a few minutes ago, I would lobby, especially here in the United States, where we have an increased focus on racial equity, particularly following the murders of George Floyd and other individuals in the spring and summer of 2020, that our policies and practices need to look through that equity lens, where we're really taking a deep introspective look at our unconscious biases across all levels, myself included, right? As a researcher and professor, all of us carry some set of unconscious biases into the work that we do. And we hope, working in the space of domestic violence and sexual violence, that we are aware and are mindful of those biases and work to mitigate the impact of those. At the same time, I think we can all work to improve, even further. So what does our unconscious bias typically kind of fall at? It's related to age and gender, disability status, race, ethnicity, sexual orientation, religious orientation, class orientation, et cetera. So if I could just mention the example that I provided earlier, if we take an example of the way healthcare asks about your relationship status, it's always, are you single, are you married, or divorced, which really leaves out the experiences of many others in society, right, who don't fit those classifications. So that's an example of needing to really examine those unconscious biases and look at things through an equity lens. We think about medical school and nursing school training. We're often focused on how to help our trainees be aware of biases that they bring into the exam room or they bring into the hospital room, and to help them mitigate the impact of their biases. I think during this social period, how can we change some of that training approaches such that all the case studies that medical students, nursing students, police officers, et cetera, are presented through the ends of equity and anti-oppression. And really individuals are asked to unravel biases and reflect upon how they carry these into situations and how this could have a direct impact on survivors. I think, to go back to what Cecilia and Noreen was mentioning, so how can we ask and probe critical questions such as how are Indigenous women experiencing domestic violence? How do our COVID policies, practices, and resources need to be constructed accordingly? How are queer youth, for example, in abusive relationships and or families experiencing the COVID pandemic? We've heard a lot at the university level, students who are now not living on campus. Many of them are in unsafe situations due to abuse they're experiencing in, related to domestic violence or child abuse, but also things related to LGBTQ or queer, lesbian, gay identity that we really need to be thinking about during this period. And I'm sorry I was a bit long-winded on that last reply, but just had a few things to say there. I'll stop there.
Those are all great insights. I'm wondering, a lot of you spoke about ways in which we can prioritize from both the practice and a public health perspective, various initiatives. And we have a number of questions from our audience about existing initiatives. So I'm wondering if each of you could comment on if you're aware of existing initiatives and whether or not they have been successful. And if not, what laws or initiatives would be maybe most helpful to formalize? And then I will also, before I unmute myself, just again, kind of welcome everybody's questions through the Q&A. We'll turn it over to Q&A after this next round of comment.
So I think the existing initiatives in India, I can very briefly talk about, is after the 2012 Nirbhaya case, the Indian government has announced one-stop centers in India and in all the states. So the one-stop center is where a woman can get a coordinated response if she's undergoing any form of violence. Now this initiative is really good and it has the potential to help many women. But if in a large country like India, if you have one-stop center per state, it is not really going to serve many women. So although the initiative is really great, I think what requires to be done is amplify it and make the budget available so that we can have many one-stop crisis centers which can help women. And the second initiative we see now very lately is with the police, where the police has been announcing tenders to invite organizations to do training on gender and gender-based violence. So we do see shifts in these constituencies trying to take a lead and make a change. And of course, NGOs have been there for ages, for decades doing their work, and they continue to do that work.
I can speak about a couple of initiatives that come to mind. In some, and this has varied greatly by states, but there have been some food aid initiatives that are not specifically focused at targeting domestic violence, but some research does find that these food aid initiatives can be helpful in reducing violence levels. And so that's sort of one broader approach that benefits the larger population. And such, similar to what Miriam was saying, it is definitely not enough. Many families are losing their sources of income, and these kinds of initiatives seem a little bit of as a band-aid or sort of patchwork. We need probably something that's better integrated, but I think these kinds of social supports and social aid can contribute to improving the lives of women and reducing their violence experiences. Also, there's been enhanced access through more phone lines. So the State Women's Institute and the National Institute have expanded the number of lines that are available 24/7 for sort of hotline help or counseling or legal help. And this can be done through text or phone. And one limitation of these, I think before I spoke of the benefits of technology, so definitely a benefit is that women can access these kinds of resources more easily. But given the pandemic, it's also at times being hard for women to find spaces where they can have these conversations. And so anecdotally, the clinicians at the Institute talked about having conversations with women while they were on their cars, because that was the only space that they could find that they could be, that the perpetrator might not be around and able to hear them, or where the children in the home would not hear the conversation. And also, I think it's important to highlight efforts related to training on gender-based violence to other governmental agencies and the police, which is something that was being done even before the pandemic, but I think becomes even more critical now.
Can I mention something that both, I think, responds to the question, Laura, as well as addresses a question that I've seen, a couple questions that I've seen pop up in the Q&A. So, and it's kind of pertaining to what can we do related to domestic violence laws that are intended to protect victims. So I'm going to talk about firearms, which is particularly relevant. I apologize for focusing on a US context, but it's the one that I'm most familiar with. We know from existing work that having firearms in the home increases the risk of domestic violence, both at the ecological and individual levels. A study by Kivisto in 2019 showed that with each 10% increase in state level firearm ownership, so states that have the firearm ownership correlates with a 13% increase in domestic violence firearm homicide rates. So we know that guns in the home is a problem. When males have access to firearms, there's a 400% increase in the risk of homicide by a female partner. We also know from a law standpoint that those states that have firearm laws that require the abuser to surrender the firearm, the weapon, to law enforcement are more effective at curbing domestic violence rates than those that don't require the firearm surrender. So actually being required to turn a gun into law enforcement is the critical and the pivotal point to curbing and lowering domestic violence homicide related rates. So I would mention that as one strategy, and say that during this time with these things becoming shadow pandemics, that we elevate and bring into national and international discourses the need to concentrate on these issues. So hopefully that's addressed some of what you've asked, Laura, and at least one angle on laws related to domestic violence. I know there's many other things that we could comment on here today.
Yeah, I think that's a great perspective, Amy. That's not just the domestic violence laws themselves and the regulation of domestic violence, but lots of other intersecting laws that address risks for violence. And I think certainly one that has come up a lot today and we've seen is economic policy can really matter. I mean, I know in the survey work we've done, we asked our participating women what their most significant concern during the pandemic was, and it was overwhelmingly economic. So thinking about, you know, all the diverse ways in which we can approach the problem, I think is a really good thing to underscore.
I think, can I add one other point, Laura? So there's a comment in the Q&A as well that adding questions to gynecology questionnaires, for example, would be another way for us to make a shift. And I know in some settings, these are domestic violence, sexual violence routinely asked about in gynecology settings or even in primary care settings. But we're not to the point that I think we're doing that systematically. And I guess my question for all of us is, you know, is this a time where we could make that a stronger pivot?
I think there is a question on, is there a difference between violence being committed on marginalized women as compared to the other women in India. And I think I would like to answer and say that the forms of violence are very different. And I think with marginalized women, it is more uncouth, unsophisticated violence. And of course, the intersections of being minority communities or being belonging to another sexual orientation, yes, they have been subjected to different forms of violence. And what happens is in a society, they are not only subjected to violence from their homes, but they are subjected to violence when they interact with other sections of society. Whereas what we see with middle class and higher middle class women is there are more subtle and insidious forms of violence. And in the last decade, in my work, what I see, so we have at NEHA registered 14,000 cases from 2001 till date. And what we see in the last 10 years is there is a big shift of forms of violence, and women have been reporting, women's accounts are much more about economic and emotional violence as compared to physical violence. So, yeah. I hope it answers your question.
I have a question here. We've had some questions about government, the role of government, the importance of laws, but I guess I'm thinking about the importance of culture, and I'm also thinking about the role of civil society. Would you mind saying a bit, this is for all of you, about the role of civil society and and also just questions about culture in combating domestic violence and preventing and ending domestic violence. I'm particularly interested in the role of religious institutions.
Yeah.
I know that they probably are more important in some parts of the world than others with regard to the issue of domestic violence, but are they largely a help or a hindrance to efforts to prevent and end domestic violence?
So I think the role of civil society organizations is very important, because in a country like India, the services are almost absent. So in such a country, even providing services for women who have been inflicted by violence is very important. The main work, if we see violence work done by civil society organizations, I think it fits into the socio-ecologic model. And the socio-ecologic model talks about prevention, primary prevention with the communities. And the religious systems are a big stumbling block to any kind of primary prevention activities that NGOs do. And if we really want to bring about that change, then working on norms has been something which we have done for years and years. And these norms are really hard to change because they have been there for years with them. So the work we do in the communities of having women's groups and having individual volunteers, I think rather than trying to really change norms, it is always better to transgress and work on new norms. And that has been our learning, that with religious systems and with other patriarchal structures in the communities, I think a new way to work is to make communities understand how they can transgress from old norms and start working on new norms. And that is something that has worked. But the shift that you see in the attitude takes a very, very long time, and it doesn't really happen immediately.
Thank you. Anyone else on that question?
I would like to add something. I think it's such an interesting question. I was trying to sort of think on my feet, and I think when it comes to culture, and you were asking specifically about religious institutions, I think at least in Mexico and in mainstream sort of Mexican culture, a large majority of the population identifies as Catholic, and there is Catholicism has very strong roots. And for many women, and this came up again during these focus groups that we conducted with survivors. Some women talked about their religion as a strength and a source of comfort, but we also found that it was culturally sort of intertwined with these expectations about being there for your family and sort of being tolerant of the behavior of a partner, putting your children first, to sort of be a good mom and a good Catholic. And in those ways, we think there's been some movement. So some women talked about receiving advice from their priest or advice from people in their religious organization that was very constructive. But some women also talked about their religion and particularly these notions about what it means to be sort of a good Catholic and a good mother, were something that was making it hard for them to make changes in their relationship.
Thank you.
I wanted to echo just quickly what Cecilia said. I mean, I think there's definitely an important role for religious institutions and particularly leadership in those institutions to play. I mean, one thing that we've seen coming up frequently in our groups here is kind of that balance Cecilia was talking about. You know, it can be a really wonderful source of support, but something that we've also seen is partners using religious texts or teachings and kind of weaponizing them to justify subjugation or violence. And I think in those cases, the extent to which religious leadership is really explicit in condemning nonviolence and promoting a comprehensive and nonviolent understanding of religious texts is really critical, and often goes unaddressed. And I think that's where, at least here in our groups, that we've seen some major problems and harms.
Great. Yeah, thank you. Yeah, it's interesting. I mean, religion can be used, and that's, I suppose, why I asked the question. It can be, I think, can be a help or a hindrance, and you know, it all depends on how people are applying religion and religious ideas to the situation. So, so thanks. And the other question would be, I mean, just educational institutions and the role that they play and don't play. Could you say a bit about that? And again, and this is for anyone.
I can speak of our experience at Universidad de Monterrey, where, as I mentioned, we started this college student mental health survey last spring in May, and we're doing a follow-up throughout the summer, and then a second sort of larger assessment in the fall. And what we found, I already talked about how at least 30% of students were reporting dating violence. And this is consistent with the statistics in the state. And this is a little bit shocking in that the population that we work with is highly privileged. We work in a private university. Students generally have sufficient economic means. There's some economic diversity, but the bulk of students are not necessarily under huge financial stress. Under typical circumstances, I think the pandemic has made everything a little bit different. And so I think leadership was shocked about these statistics, about the high percentage of students who are experiencing dating violence. And I think that this speaks a little bit to the fact that we are just starting to build awareness in our community about this problem, that very long it has been thought of a problem that only affects sort of married women with children of lower economic status who are not well educated. And I think that maps onto a question someone asked about women who are well educated and and have good awareness, and you wouldn't expect that they are in these situations. And the reality is that domestic violence affects women regardless of their education level. We've mentioned how we do see some concentration and different stronger impacts for women who are also in other ways marginalized, but this is not something that does not affect women who are educated. And I think that as an answer to your question, I think educational institutions do have a very important role in terms of awareness. And at least in our institution, we are kind of just starting on that path.
Thank you.
I like Cecilia, thank you for your comments. I agree with that. I think, we have a tremendous role to play. And I would think about training the next generation. So, we've thought we've got something at Michigan State University called the Research Consortium on Gender-Based Violence. And it really brings together faculty, staff, and students working in these areas. I think as educational institutions with domestic violence and other types of violence emerging as these shadow pandemics, we'd be recruiting cohorts of students who are interested in working in these areas and being trained in these areas. Going to graduate school in these areas with a specific focus on training students and recruiting students from minoritized backgrounds. So I had an opportunity to participate in a national mentoring consortium called McBee, which convened about 30 universities from across the United States over the last 4 years. And it was wonderful, absolutely terrific. So it had senior mentors and junior mentees. And one of the things that was striking to me was the absence of mentees from minoritized backgrounds. And I think that speaks to, we need to be training and recruiting students who will then form the pipeline of faculty, right, working in these areas. And I think this is particularly important when we look at domestic violence prevalence rates, for example, and impacts. We see the profound impacts on minoritized populations. I think we need individuals working in these areas who can interface effectively. I'm going to make one comment, because I've seen it here for the last 20 minutes, just quickly if I could. So there's a question from Simone De Silva about what does one do when the well-educated and aware woman endures domestic violence silently. I think it's a great question. I think right now, as we're talking about changing norms and what the role of educational institutions and what society can do, what healthcare organizations can do, I think, from that advocacy standpoint, as individuals, not being afraid to proactively continue to reach out to those individuals who may be experiencing and enduring things silently. If you notice warning signs, continually we're reaching out and saying, hey, you just want to check in to see how you're doing, and not making judgments about where an individual might be in terms of their readiness to make any kind of change in their life. So I would suggest, I've always kind of remind family members and friends that never withdraw support, even if you think that what the person is doing is wrong and staying with somebody, or you're not supportive of their situation, but supporting them regardless in a non-judgmental way if you can.
Perhaps at this point, it'd be just great to hear from each of you, just any kind of parting comments, or what you would like to leave us with, some parting comments on this really important topic at this time. So I just maybe we could begin, with you, Cecilia, and then work our way around Irene, and then Amy, and then turn to Laura to bring us home for a landing.
Of course. I think I've been as we were talking, maybe reflecting on, I think we all talked about the importance of raising awareness, and that sometimes statistics might not reflect the true reality of what's going on, at least some of the examples I gave you in regards to women's ability to report or access care, which might be diminished right now during the pandemic. The other piece I was reflecting on that I think we didn't get to speak as much about has to do with informal supports and resilience. There was one question of someone, I think this piggybacks on what Amy was mentioning, about women who are maybe not ready to ask for formal help. And so I think through my experiences with survivors of domestic violence, I've learned that, of course, I want them to receive the services that are available to them through our different agencies, but also the importance of their own support systems, family members, friends who are not judgmental. And also this resilience that they do have within them, that has to do with their children, or it has to do with their own strength and their own plans and hopes for the future. And so I also just wanted to sort of bring that back into the conversation, because I agree that this is I think someone talked about a pandemic within the pandemic. This is a growing problem and one that deserves attention from multiple levels. And also, as we speak about women who are having this experience, not forgetting sort of their individuality and their strengths.
Yeah. So taking forward from Cecilia, I think, yes, one thing which we have failed to do is we have failed to create an ecosystem where the woman can actually report to violence. And yes, I agree, formal, informal systems are required for the woman to report. But I do feel that if violence is not normalized and not tolerated, then I think women will easily approach and report it, and not go to very informal systems like in India. The National Family Health Survey data shows that 37% of women have reported domestic violence, but only 2% of women have sought help. And the others who have gone to their family members, nobody knows what has happened to them. So I think if this whole culture of normalization is changed and an ecosystem is created where domestic violence is not to be really tolerated, and wherever the woman goes, she will get help, I think that will really change the whole scene and the whole scenario.
Okay, thank you. Amy?
I think right now, emphasizing that approaching things through an equity lens, through this lens of equity and intersectionality, looking at how gender interfaces with race, ethnicity, age, disability status, sexual orientation, religious background, etc., and really helping us think about navigating this shadow pandemic within the pandemic of COVID. I unfortunately, looking at the COVID numbers, it looks like things are going to be getting worse before they get better. And I think that unfortunately probably says something about what we'll be seeing in terms of domestic violence and sexual violence as well. And I think however, within a crisis period is an opportunity, right, for a renewed focus and a refreshing focus on these issues. And I think we're all poised and talking about doing that today together. So I'm hoping some of what we shared today was helpful, and look forward to hearing from you as well in terms of your comments of other things that we could be thinking about.
Okay, well, thank you to all of you. I'll just maybe As we wrap up, kind of tie together some of the overarching points that have emerged from our conversation, which really has been, I've so enjoyed learning from all of you. And I kind of sorted my thoughts into, I guess, two buckets of, learnings in terms of what we can all do as individuals and what we can think about doing as civil society and also at the kind of practice and policy level. And I think some of the things that emerge consistently across our conversation is the importance of not normalizing or tolerating violence, as Nyreen mentioned in her closing comments. And it's consistent with research on things like informal social control, that people's perceptions and attitudes towards domestic violence really do influence their friends and their neighbors and the likelihood that violence will be perpetrated. So being, I think, forward and, as many of you said throughout the conversation, proactive, explicit, providing both that informal norm against violence, as well as continuing to provide informal social support to people who may be affected by violence is really, really critical. And again, kind of that informal support lines up with research showing that individuals who experience domestic violence are most likely to disclose that violence first to someone in their informal networks. The formal report is likely to come later. So I think in terms of action we all can take, that gives us, some good direction there. I think thinking more broadly, institutionally, I really liked, some of the comments around, the importance of institutionalizing our learnings from the pandemic. Where have we kind of been forced to grow? And as Amy said, have this crisis really be an opportunity moment of both heightening awareness, but also thinking about, how can we better provide a diversity of resources and supports, and think about the complex intersection of lots of different policies and laws to promote nonviolence in our communities and societies. And I think, one of the things that I've most appreciated, and I'm grateful to Notre Dame International for providing this forum, is I think exchanges like the one we've had today, are really, really valuable, because different communities and different organizations have implemented a wide range of approaches. And I think the opportunity to learn from one another and think about, both how we need to address the unique needs within our context, but also how we might translate learnings across contexts that have really been successful in other places, is really exciting. So thank you to all of you for your outstanding comments and for being here today. It's been wonderful.
Thank you, Laura. And we really can't thank you enough, Nyreen, Amy, and Cecilia, for this really great discussion on such an important topic. That this is just obviously the continuation of a conversation. And it's hard to imagine a more important topic with regards to human dignity. Ultimately, finally, it's about respect for human dignity and promoting awareness of one's human dignity and doing a better job of that. And I think there's so much work to be done, and you're part of that great work. So I really want to thank you for that. Thank you, Laura, for moderating this discussion. Really appreciate it. There are a few other people I'd like to thank. Jer Meehan, she was very much at the core of this whole effort. She was leading the charge, and she really initiated this idea for the roundtable, and what a great idea it is, what an important topic it is. I want to thank Ali Richthammer also for all of her support in this effort, Corey Klimek and Mark Schultz for all their incredible work in helping us, as well as Colleen Wilcox, Matt Esau, and Diane Moore. So we really can't thank all of the NDI team enough for all of their help with this. So our next roundtable will be October 29th, Friday, October 29th, from 9 a.m. to 10:30 a.m. Eastern Time in the United States. And that's going to focus on the pandemic and its effects on primary and secondary education. We'll feature perspectives from Chile, from Kenya, and the United States, and beyond for that matter. So that's Friday, October the 29th, 9 a.m. to 10:30 a.m. Eastern Time in the United States, the pandemic and its effects on primary and secondary education. But I wish you all a great day wherever you are in the world, or a great evening, depending on the time, your time. And I just hope you have a great weekend as well. Thanks everyone for joining us today.
Thank you. Thank you so much.
Welcome.